Hello. Okay. Hello, Doc. Good afternoon.
Good afternoon.
How are we doing today?
We're great. Same you.
I'm also good.
Okay.
Okay. So today we are just coming to ask you some few questions pertaining to yourself and your lifestyle.
Okay.
How you have been able to move from being a medical student to being a consultant currently. Okay. Our first question for today will be that, please, what's your name and what specialty are you in?
So I'm Dr. Hawa Malechi. I'm an obstetrician gynecologist and a senior lecturer with the University for Development Studies School of Medicine.
Okay. And please, which senior high school did you complete, and then which medical school did you complete?
So I completed the Great Tamale Secondary School.
Yes, I'm also from Tamale Senior High School.
Tamale School. And I attended University of Ghana Medical School.
Oh, wow.
Yes.
A very, very great school.
Yes.
And also, please, where are you from?
I'm from Yama, which is under Wale Wale in the West Mampusi district.
Okay. And then, what made you choose ONG?
I had a very impressive rotation in my house job in Taberton, Cape Coast, as a house officer, and I really was impacted by the senior colleagues I worked under, and coupled with my time in school, in medical school, I think ONG was what made sense to me.
Wow, that's great. And can you just tell us a little bit of what obstetricians and gynecologists do?
So it's about taking care of women so far as the reproductive tract is concerned. So the gynecology is the medical part of the reproductive tract and its conditions. Mm-hmm. And then the obstetrics is about reproduction itself. That is about making babies, getting pregnant and having a baby. So we take care of pregnant women. We help people get pregnant. We take care of them during the pregnancy and then after the pregnancy. And then we also deal with all other reproductive tract concerns.
Okay. And what's your favorite part of medical school?
Was there any favorite part?
At all.
Medical school was just about, reading, learning, IAs all the time. I think maybe the very small pieces of time that I got to play lawn tennis, I think that was just those times I would say was nice. But as for the learning, we learned because we had to learn, so it wasn't really fun, but we just had to do it.
Oh wow, seriously. And also, what specialty did you think you were going to specialize in when you first started medical school?
Initially, I was blank. I didn't have any. I actually didn't even know that there were things like specialization. I thought being a doctor was just about it. Okay. Much until I started doing the clinical part, and then I was very much interested in pediatrics. I loved the kids, the babies, wow. And I felt that I was going to be a pediatrician.
Yes, the kids.
But house job pushed it out of me quickly.
Oh.
Because I was almost always getting upper respiratory tract infections from them, examining their throats, and I was like, no, wow. I'm not going to do it. And I really didn't have a very nice experience with it because I did my pediatrics house job in the heart of Accra, PML, where there were a lot of Kayayu girls coming with their children, very, very ill, convulsing babies, and yet they didn't have money to buy essential medications for these babies. And most often than not, you have to spend your meager house officer money buying drugs because you don't want to watch this baby suffer. I thought it wasn't something I wanted to do.
That's true.
So that's when I changed my mind.
Oh, okay. And also, which specialty is just not for you?
So I see myself as an all-round person.
Okay.
I like almost every part of medicine. In medical school, I was okay with everything, and I had awards in almost all the categories. So, but if you ask me to rank all the things that I would do, I think internal medicine will be last. Yeah.
Because some of my colleagues are actually choosing internal medicine.
Maybe they love it. Definitely, there are some people who love it, but I think personally, I think that your house job experience plays a significant role in what you finally become. So the places I didn't have good experience, I think I didn't have a high on my list. I did my house job in internal medicine in Koforidua, and half of my patients had CVA, the other half had AIDS.
Wow.
And every day it's a mortality. I really didn't like it.
That's a bit sad. How long did it take to be a consultant?
Very long.
Wow.
So I started specialization I went to Ghana College in 2012. I did both Ghana College and West Africa together. Then I came out with membership in 2016, but I came back to Tamale to work. So I worked until around 2019 when I went back again to start fellowship. So I didn't continue with fellowship completely. So I was done with fellowship just last year, 2023. So there's been breaks, but without the breaks, it will take you about maybe 7 to 8 years if there are no breaks.
What's the most unique part of this specialty?
Okay, so you will get to see all manner of people. You get to experience your clients, and then you get rapid results. I think that's one of the things in ONG I like, because you put in the inputs today, and then in a few minutes you see that your patient is getting fine. You see, unlike some other specialties that handle patients who have chronic debilitating disease, that takes a while for you to see results. So I think that's one of the heights for me in ONG.
Okay. Why should someone choose ONG?
If you love it.
I like that short and nice answer. Seriously. And why should someone not choose ONG?
If you don't love it.
If you don't love it.
If you are not somebody who can work outside yourself, if you are not selfless, you can't do ONG, because you would work beyond your normal working hours. You would be called in when you are not supposed to be on duty, and you have to call. You have to answer the call. You'll be asked to come in when you are not even expected to be there. So if you are not a selfless person, you'll be frustrated as an obstetrician gynecologist, because your personal space will just be breached at all times.
Okay. What's the funniest question or health-related question you've been asked before?
Funniest health-related question. Okay, it wasn't a question, but it was like an exclamation. So there was a client whose wife was carrying triplets. So we all were expecting 3 babies. Then we entered theater not knowing we had missed a 4th baby during the pregnancy. So as we delivered, the 4th baby came through, and then when we came out and broke the news to the husband, he just exclaimed and said, "Haba," in the local language, "Haba, Piera Nahe." You know, like, yes, in Dagbali. He's thinking of the 4 rams he has to buy to name the 4 babies. And I think it was really funny to me at that point. He was not, all that he could just hear in his ear was Piera Nahe. I mean, he has to buy 4 rams within a week.
Wow. And what's your normal routine in the hospital?
Okay, so you arrive in the morning, you'd go for morning meeting, starts at 8, usually will last an hour. Depending on the day, you have an activity. So it could be ward rounds on Monday, it could be obstetric clinic or the gynae clinic on Tuesdays. It could be a 24-hour duty on a Wednesday, or post-duty rounds on Thursday, and it could be gynae theater on a Friday. And every other weekend you're on weekend cover, which is also 24 hours.
What's the average number of patients you see in a day?
So it depends on where you are. So if it's the clinic, because of the level, you may be assigned maybe 10 patients, but then you have to help your junior colleagues handle their case, so you see more than that.
And what's the hardest shift you have ever had?
There are so many. I don't think there's a hardest. How many hardest can I describe? So there are so many. Just let me see. A few weeks back, I'm not even going to go far. I was called in when a woman's uterus had ruptured, and we were in theater for several hours. It was difficult to control the bleeding and all that. Those are some of the hard times, and especially when you don't have all the inputs you need.
And then what's the scariest delivery situations you've experienced before?
Scariest?
Yeah.
Or maybe my scariest was when I was a house officer, when really I didn't know what to do. I remember one time I went to help in my mother district, Walwale District Hospital. Anytime I was on leave as a house officer, I would go there to help. So on one occasion, the medical superintendent had left already. He had gone home, and I was there with the midwives in the labor ward, and a woman came to deliver, and then the baby's feet and all that were out, and the rest of the body won't come. We did everything that we could do. The baby won't come. It was so scary. And at that time, those times, we didn't have access to ultrasound and all those things. So I was torn, and we knew the baby was lifeless, but it wouldn't come. I had to call in the medical superintendent, and he with his experience, he guessed that the baby could have had an abnormality. So he asked me to do a certain procedure, examine and see whether the abdomen was enlarged, and I said yes. He said put a needle through it, and I did it, and all the water, so the baby had ascites, it was obstructing, so all the water drained and the baby came, and it really was scary at that time.
And what's the toughest part of your job?
Working long hours, working, having multiple emergencies at the same time. You could have an ectopic here, a ruptured uterus here, a baby with a bad fetal cardiac activity here, and all that happening around the same time. You have to charge yourself. You're almost running all the time. So most obstetricians, we have loud voices. We can shout because you need to shout to get things done.
And what's the most rewarding part of your job?
See my patients smile.
Smile, wow.
Just say thank you, and they are happy. You see the smile on their face, and you know you've done your job right.
And what time do you usually wake up every day?
So my waking hours 4:30. Usually 4:30, 5 a.m. and then after my morning prayers, then life starts. So if I have any things I have to do on my PC, then I start at home and then get myself ready. I have to get my kids to school, so by 7 a.m. we are out of the house. I'll drop them from school and then I'll be here before 8.
And how many hours of sleep do you recommend?
Minimum of 6 hours, and I make sure I get that. So I go to bed very early.
Okay. And I think you mentioned that you get home, you get to the hospital early, having the meeting at 8, which lasts like 1 hour. And around what time do you usually leave the hospital?
So it depends on the day. If other days I can leave as early as 2 p.m. But when it's a duty day, then you can stay very long, sometimes 5, 6 p.m.
And Doc, are you a night person or a day person?
I'm a morning person. I'm a day person. I'm like chicken. So by 8:30, 9 p.m. I'm asleep.
Wow, that's really good. Seriously, I'm also one too. I sleep very early.
Yeah, I wake up early.
Okay. And what's the most interesting case you've ever seen?
Okay, so there are so many, but let me just tell you the recent one. So there was a young lady who had a very bad postpartum hemorrhage, and we tried all that we could. It was her first delivery, so her doctors did everything they could to make sure they didn't have to take off the womb in the process of saving her. So I think after that, she made it. A year on, her menses wouldn't come. She returned to us to find out why. When we checked, we realized the inner lining of her womb was destroyed in the process of keeping the womb in, all the things that we did. So we tried all attempts to get it for her to resume her menses. Menses never came. I even referred her to other hospitals down south, other teaching hospitals. They worked on her. It still didn't work out. So we settled with her just keeping her baby and just knowing that it was a complication of trying to save her life. 3 years down the line, she calls me that she wasn't well. She went to the hospital and they said she was pregnant. This is somebody who has not had her menses for several. And truly, she was pregnant, and she's had a baby again.
Wow, that's a very fantastic and great case.
Yes.
Wow, I would have loved to be there. And what condition have you diagnosed the most since you started your practice?
Pregnancy.
Oh wow. And what medical advice will you give to most of your patients?
Most of my patients, I think it depends on the category of patients. Now, at the level that I have reached, most of the cases I see are those who have difficulty in conceiving and then they want to conceive. So you need to just tell them to be patient, because things happen and they will finally get there.
Okay. And what's your favorite thing you like to do when you are not working?
Cooking.
Cooking. Wow, that's good. Dog, I'll come to your house so that I'll come and eat some nice jollof.
All right.
And who in your family had the greatest impact on your education?
My senior brother, who is no more, blessed memory. He was the big brother that everybody would like to have, and he always made sure that you took your studies seriously and encouraged you to, challenge yourself and know that you can make it. Next to him is my mom, who did everything that she could do as a mother to get us the resources we need.
Wow. Oh, that's very, very nice. And may the Almighty Allah grant him Jannah for those. And do your family ask you for random medical advice?
No, they usually would even go and try all sort of things before they now remember that, okay, there's a doctor in my family. So usually friends, family, not too much.
But then when they ask you a question, which question have they asked you that you felt that it was weird?
Can't think of any.
Okay. And what's your favorite and nerdy random medical question?
Can't think of any.
Okay. And then did you get married in medical school?
No.
Okay. And what would be your advice for those that are planning to get married while in medical school?
It's a great idea. If you have a supportive spouse or a supportive partner, someone you're dating, and you think will not be of too much bother because medical school is serious business. And for us, we those who school down south, it's up north here. I came and realized that medical students like to marry whilst they're in school. In Accra, it wasn't like that. You are in medical school, you are focused. You just have 1 or 2 medical students married. But in Tamale here, it's very common to see medical students married. But why not? If you have somebody who would give you the space you need to learn, it's fine.
Okay. And how do you maintain work-life balance?
Number one, you need a supportive partner, and I am very happy with my husband. He's been a great support from day one, and he's been my greatest cheerleader. He's always there to cheer you on, support you, take care of the kids in your absence, not bother you too much with so many things that he knows you should have done, but because of your work you can't do. He would always make space for you. So I think that's just the first thing. Once you have that, and you should also plan your time so that you can have time to make up for all the lost time, because you spend a lot of time at work. But when you have time, you just have to shut the world out and then just have time with your family.
So relax. That's very good and necessary. Some of us are not privy to some of these things before. We just feel like everything is just the academic work.
No.
And then we have to balance it up.
Yeah.
And then do you have any pets?
Yes.
And which animal is it?
I have 2 types.
Okay.
So I have a dog.
Okay.
It's called Poppy.
Poppy.
Yes, it's Poppy because my little girl named it Poppy because it came in as a puppy, and then it was just Poppy, and it's 7 years old and it's still a puppy. And then I have an aquarium. So I have some fishes that I haven't named them though, but we talk to each other.
If you had to have dinner with anyone in history, be it maybe the person has passed or the person is still currently alive, who will it be?
I would like to have dinner with Kwame Nkrumah.
Kwame Nkrumah. Wow. And what will you be eating?
Acheke.
Acheke. Oh, though not a lot of people actually know about Acheke.
Yeah, Acheke is nice.
Very, very nice. Seriously. And what's your favorite place in Tamale?
My home. My home. I think so.
Wow. Okay. And who was your top mentor?
So it's been okay. So if you say top, I would one of my consultants. I would say that it's been changing as I've been revolving, but Dr. Gumanga has been of great influence in my life, and I'm really happy I met him.
And do you have any hobbies? Okay, can you share with us some of them?
So I mentioned that I like to cook.
Yes.
I like to try my hands on all sorts of cuisines.
No.
I just have to see the food and I can imagine what the ingredients are, and I would also prepare it.
Wow.
So my favorite TV program is Food Network on DSTV.
Wow.
And I watch that when I'm at home, and then once I can get the ingredients, I try my hands. So I think that's one, and then the next is just doing fun activities with my kids.
What's your best way to relax after a stressful day?
Going to my kitchen, doing some cooking, play some music.
Wow. Nice.
Sing along.
Wow. And who is your favorite artist?
Okay, so I have so many favorite artists, but right now I think it's Daniel.
Okay. Wow. And Doc, are you an introvert or an extrovert?
Extrovert.
Extrovert. Okay. As a kid, what did you think you were going to become, or what field do you think you were going to?
I had always wanted to be a doctor.
A doctor. Wow. Right from the beginning.
Yes.
And do you believe in passion?
Yes, I believe in passion.
Is there any other specialty you think you could have done?
I think I could have done. I think I've blocked my mind off all other specialties, but supposing they said ONG never exists or it didn't happen, maybe I would have been a general surgeon.
General surgeon. Wow, that would have been great too.
Yeah.
And if you didn't do medicine, what do you think you'll be doing right now?
Fashion design.
Fashion design. Wow.
Or just cooking, a chef.
Chef. Those are great places too. And also, is there any specialty you think you could have done? So, okay, I think I've asked this question actually. So, are there times you felt like giving up?
I think there are times that you'll be so overwhelmed, but giving up, I don't think I've reached there yet. But you get so overwhelmed and sometimes, but you just have to pick yourself up. But I haven't thought about giving up.
And those times that you felt overwhelmed, how were you able to cope?
So you just take a few steps back and just realize, depending on what the situation is, whether it's a work situation or a life situation. My senior brother used to share some words with me that no matter your situation, just take it as the best that it could have been at the time, because it could have been worse. So once you start feeling that this is not the worst that could have happened, something else could have happened that would be worse, you start thinking of the next step. How do I get myself out of this? And then you focus your energy on that instead of whining around the problem and then being soaked in it.
Yeah. And if you could change anything about the medical field, what would it be? What would you like to change?
About the medical field in general?
In general.
What would I like to change? I can't think of any. I think I love it the way it is.
It is. Wow. And what will you tell any medical student that is planning of specializing in ONG right now?
If you want to do ONG, lace your boots. Know that you need a lot of sacrifice to be successful, so you should be ready for that. Be ready for long hours of work, back-breaking, but it is rewarding. So once you are thinking about it, just get ready, take your studies seriously, and the rest will just fall in line.
Okay. And this is our last question for today. Would you change any experience you have had up to this point?
In the line of my work?
Yes.
Okay. If there was any experience I didn't like, and I have made efforts to change. What I didn't like is when I was a resident, I started residency with a baby, my first child, and he was just 5 months old, and I had to go and do 24-hour duty.
Wow.
I didn't like it. I felt that we were enough in the team to do a comfortable 12-hour duty so that we could rest. We are humans. We can get tired. But I think it's been like that across countries. I mean, obstetricians work long hours, for 24 hours straight, 48 hours straight, and stuff like that. It breeds a lot of mistakes and fatigue. So coming back here in Tamale, I made sure that we run a team 24-hour duty, but within the team you have a 12-hour duty, so that you can rest and come back the next day. So that's one thing that if I had a chance to change everywhere, I would have changed. But in my small corner, I have made sure that it's not like that.
It's not like that. Doc, thank you very much. We really appreciate your time answering our questions. The questions have been a lot, but we really appreciate you explaining and giving us like detailed explanation to some of them. And as for me, because I'm a Tamascan, I will have to ask. You took the award for Ghana Women Award since 2021. How has it been like?
Oh, well, so the awards have been different since 2021. So 2021 was a COVID award. And then 2022 was another award. I think that one is here. That one is Humanitarian Awards Global for Most Exceptional Change Maker.
Wow.
And then the 2023 is the Ghana Women's Award. And then in 2024 there was another
one too. Wow, this is what we call back to back. Seriously, this is a treble. Okay, Doc, thank you very much.
You're welcome.
I really appreciate your time.
You're welcome.
I'll see you next time.
Bye.
Okay.